I spoke on this program a couple of weeks ago to Jo Nova. She argued this was the biggest medical scandal since 1850, why a cheap, safe drug was actively suppressed because it threatened the emergency use authorisations for all experimental vaccines, an industry worth about $100 billion. Well, now, of course, the Therapeutic Goods Administration says, oh, ivermectin's okay. But Big Pharma have taken their money. Others have lost their jobs for not being vaccinated and are still denied employment, which brings in Jay Vidinage, a South Australian barrister based in Port Adelaide. He's represented a number of individuals in COVID-19 vaccination-related cases, particularly those who became unemployed as a result of conscientiously objecting to the mandates at the time. And Jay Vidinage also rightly argues that this banning of people who aren't vaccinated has created mass staff shortages, especially in the public sector. Jay Vidinage joins me. Jay, thank you for your time. I mean, we're not going to get a Royal Commission because both political parties will be frightened of what would be revealed, but I'm receiving letters every day from desperate people who've lost their employment because they're not vaccinated. You're representing some of these people. What are you finding?
I've been doing this for over 2 years, Alan. First thing I'd say is not a single risk assessment has ever been done in this country by any of the big companies, BHP, Qantas, Woolworths, Coles, or any of the public health departments, New South Wales, Queensland, Victoria Health. They always default to the TGA and ATAGI to say, well, if it's approved, it must be safe. There's absolutely no risk assessments done on young, healthy people with no comorbidities that are in the highest risk of catching myocarditis from the vaccines, as everyone at this point in time can agree. Yet these mandates still exist in South Australia, Queensland, New South Wales and Victoria at this date. People are still being terminated because they're not two-dose vaccinated, despite having natural immunity, despite clearly the risks outweighing the benefits for these people. And their dismissals and their ability to not work or being stood down is creating big shortages in an already sector. So it's just astounding to this day that the courts don't see it that way, and the tribunals don't see it that way either.
But see, Jay, you mentioned that the shortage of staff, and we know that police, nurses, doctors everywhere, massive shortages. But the damage, emotional, psychological, to people who've got children to feed, and they just happen to be professionally accomplished in the health area, and they can't get back their jobs. And I mean, what do these people do?
That's correct. I'm doing everything I can on our end. There's very few barristers and lawyers who are working with this. It's sort of a taboo area for most law firms. A lot of law firms mandated the vaccine themselves in order to gain favour with big business and government. So there's very few of us fighting for this. Obviously, if you're unemployed or you're stood down, you have very little money to spend on any kind of high-end barristers or law firms. So we're doing this to help those battlers out there. The psychological harm is something we brought up and were ridiculed for bringing up in the first place. I can't describe to you how mentally scarring this has been. The most mentally scarring things for thousands of Australians out there, not being able to pay your bills, defaulting on your mortgage, losing your job, which you love. And I can tell you, nurses in this country love their jobs. They love helping Australians. They love helping everyone going through trauma right now. And then they've been stopped from doing that. And those who are forced to be vaccinated are now suffering mental harm from the understaffing on unprecedented levels. The ramping, the waiting for ambulances, the dissatisfaction is at the highest I think I've ever seen it in the healthcare system in this country. Everyone's been abandoned, Alan. There's no care at all for these people.
And who's listening to you?
The judges look down on them.
I mean, who's listening to you? Who's taking any notice of what you're saying?
I know Red Union are probably the only union that have stood up in this entire time, and they've had to battle with everyone to even remain in existence. No other union will touch vaccine-related matters. They'll glance at it. They may help a bit here or there, but none are coming out and helping the average Australian worker. Those who do finally have to get vaccinated, who are forced to, are bullied and oppressed when they come back to work. There isn't really anyone outside of people like yourself and Red Union at this stage. It is David v. Goliath. I can't be more honest than that, Alan. I know in other countries the mandates have dropped. I mean, here we recently concluded the trial against SA Health. The decision came out yesterday against us, in which they relied on UK data. And then if you look at the UK, they haven't had mandates since January 2022. Yet somehow South Australia believes 2 doses is still required in September 2023 and is sacking hundreds of nurses and has sacked hundreds of healthcare workers in the last 2 months alone.
It's frightening. This is terrifying stuff. I mean, put yourself in the boots of some of the people that Jay's talking about. I've quoted many times the professor at Stanford University's Michael Levitt. Way back, he said the level of stupidity going on here is amazing. But the issue, and I'm saying to you, our viewers out there, you ask this question. I mean, Jay and I are not stupid people, and I suppose we've got a bit of clout in the community, but no matter to whom you speak, you can't stop this stuff. A ban on people working because they're not vaccinated.